Hi, this is Gene Ransom with MedChi, the Maryland State Medical Society, and I'm here with Julia with Medical Business Partners. Julia is an expert in all things practice management, coding. She's one of the best in her field, and we're talking about this period of time here where we are reopening medical practices. Hi, Julia. How you doing today?
Good. Thank you so much for having me.
Yeah, so the first question I really want to ask is how does a practice make the decision as to whether or not they reopen now that Governor Hogan has said in Maryland they can?
That's a very good question. So, as you stated, Governor Hogan is allowing healthcare providers and facilities to resume elective and non-urgent procedures. However, there are six very important requirements that healthcare practices must adhere to in order to reopen. So, to summarize these six, the first one is use your best professional judgment in determining which services to perform. Have at least 1 week supply of personal protective equipment, PPE, for yourself, your staff, and when needed for patients. Social distancing requirements must be strictly maintained in all settings, so staff may need to call ahead for patient registration, and you can have patients wait in their car until they're called. All healthcare workers and patients must be screened for COVID-19 symptoms upon arrival. Implement strict sanitation and cleaning protocol in accordance with the latest CDC guidelines. And lastly, suspend all operations and procedures if the practice is unable to provide PPE for themselves, their staff, or their patients. So if the practice can attest to all six requirements, they must certify that information to the Maryland Department of Health. And MedChi has created a great sample form to help with this process. It's available on their website.
So, Julia, I know you've been helping practices for 20 years, and you're really an expert in billing and coding, and Medical Business Partners is a name that we know in Maryland who does this. If you've got a practice that kind of meets these conditions that you're working with, and they've been doing telehealth just to kind of stay open, what do you suggest to them with regards to telehealth going forward in this period if they're able to reopen? How do they adjust, and what should they do with regards to telehealth?
So first, with reopening phases that are starting right now in Maryland, it's important to keep in mind social distancing is critical. So telehealth is going to be a great way to still be connected to your patients and treat your patients when appropriate. So during these unprecedented times, telehealth has been extremely deregulated, with many services currently being allowed to be performed virtually that were never allowed before. Many payers are even reimbursing providers at the same rate for these virtual services as in-person encounters. Telehealth is safer and much more convenient for patients, staff, and providers. And it's also a great source of cash flow. There are a couple key things to keep in mind. So number one is to stay on top of all the latest updates. They are changing very quickly. Verify patients' insurance benefits. You want to make sure you're documenting thoroughly. And if possible, only use HIPAA compliant telehealth devices.
Yeah, so they've relaxed HIPAA, but obviously, as we move back in, they're probably going to lift those relaxations. So I think that's an important point. Where do you go if you're a practice and you need help? Because I think, like you said, these rules are changing constantly. What do you suggest to people who want more help on telehealth?
Absolutely. So I know you guys have an absolutely incredible website that's being updated at least several times a week, and they are more than welcome to reach out to us as well. We've been doing lots of webinars that are also available on your website on the latest coding and billing requirements per payer and specific ways to code for it, including place of service, modifiers, etc., the way that you need to document your notes. And that information is changing week to week. So it's important to stay on top of all these denials or changes that are currently going on and visit your website.
Yeah, those webinars you did are on the website. They're terrific. And again, we also have a coding guideline one pager on there. So, okay, so you've reopened, you're still doing telehealth, but your volumes are going to be lower. And I guess one of the questions I have, given the long time that Medical Business Partners has been in this business, what tips do you have? What practice tips do you have for these docs from an economic point of view to make the practice viable if they are going to reopen?
Sure. We have about 6 tips that we would recommend for most practices. And the first one is to make sure that you keep providing telehealth, virtual check-ins, and e-visits when possible. Number 2 is open up your practice for appointments and procedures that definitely adhere to all of Governor Hogan's requirements. You will have to practice social distancing and all the sanitation protocol, but it is important to start resuming operations. The third one is have your staff follow up on all outstanding insurance accounts receivable. This is a really great time to clean up your old AR and can be a significant cash flow for your practice while your patient volume is down. Number 4 is to make sure you're sending out patient statements regularly and you have your staff call patients with a high balance. You are much more likely to reach people during this pandemic and they are much more likely to pay. Number 5 is develop a marketing plan if you haven't done so. How do you want to position your practice for the near future? Maybe work on your website or reach out to your satisfied patients and ask them for a review. Reviews are playing a huge part in attracting new patients and potentially renegotiating your contract with insurance companies. And lastly, make sure that you take advantage of all the grants and forgivable loans out there. There are several federal and state-specific grants that can be extremely helpful right now.
So thank you so much for joining us today, Julia. I don't know if you wanted to tell us a little more about medical business partners and closing, but I did want to encourage folks to reach out to MedChi if they need help with anything. If you're a physician in Maryland, we're here to help you. Julia, do you want to say anything else about medical business partners?
Sure. We, prior to the coronavirus, we were primarily providing billing and consulting services to doctors, such as coding audits and educational services and training their staff. Now, with the pandemic going on, we changed our focus to telehealth and helping doctors see more patients and generate maximum cash flow. We're also helping their staff figure out best ways to tackle AR and ways to generate more revenues right now. So if anybody has any questions on ways to reopen your practice, find ways to increase cash flow, or telehealth services, how to get paid for them, definitely please reach out to us. I'd be more than happy to help you.
And you see, both Julia and I have put our emails at the bottom of this screen here. Please reach out if you need anything. And thank you to all the healthcare workers who are doing so much to keep us safe in these complex times.